Drdo developed counter-COVID-19 technology Samprac software KAVASAM software Samprac which prediction software sodium hypochlorite gel innovation national PPE testing facility automated system for decontamination of N95 Fesimisks containerized test module mounted area sanitization unit PARAKH mobile BSL-3 laboratory for COVID samples testing ventilator-based attendance application AINA. Drone-based surveillance system Samprac, video conferencing solution in internet Medidoot, medical Trolley acoustic throat infection analyzer, Asia crowd temperature monitoring system PARAKH Shima app for COVID-19 infection self-assessment test AI-enabled face recognition based contactless attendance system. AI-based intelligent COVID-19 detector technology for medical assistance, ATMAN. First, Samprac software smart automated management of patients and risks for COVID-19. The Drdo launches COVID-19 tracking app, Samprac the Center for Artificial Intelligence and Robotics, CAIR, a Bangalore-based lab of Drdo, has developed an app called Samprac to enable tracking people under quarantine. Samprac is a software that includes an app that would be installed on the smartphones of the infected COVID-19 patients. It is a server-side application that would be used by the state authorities to track the patients. Hosted exclusively for the use of state governments, it took scientists about 3 weeks to develop it. The system would enable geofencing, AI-based automated face recognition between selfie taken during registration and subsequent selfies sent by the patient, and would have the capability to display the information to the state officials on a map, which can be color-coded to depict hotspots and containment zones. Samprac is expected to drastically reduce the overhead of tracking every patient under home isolation, thereby reducing the load on the state machinery. Second, KAVASAM software, COVID-19 tracking and resource allocation. Genai Defense Lab develops KAVASAM app to help COVID-19 warriors fight virus. Currently available apps like Araja Sedu, which is being widely promoted by the center. KAVASAM is meant to ease the work of frontline workers, enable street-level surveillance and aid quicker decision-making by those in charge. The app facilitates geofencing of homes of those under quarantine to monitor their movement. An automatic notification will be sent to the super admin, epicenter head and team leader police if the person moves 100 meters away from the location. Different color codes are given for authorities to know which streets have been surveyed. For instance, if health workers finish collecting data from a particular street, it will be shown as green in the app. Third, automated system for decontamination of N95 Fesimisks for frontline workers. In response to the N95 mask shortage caused by the COVID-19 pandemic, the US CDC has recognized moist heat as one of the most effective and accessible methods for decontaminating N95 masks for reuse. To this end, we developed a wireless sensor platform for moist heat decontamination process verification, capable of monitoring hundreds of masks simultaneously in commercially available heating systems. Our easy-to-use, low-power, low-cost, scalable platform can be broadly deployed to protect frontline healthcare workers by lowering their risk of infection from reused N95 masks. Fourth, PARAKH, mobile BSL-3 laboratory for COVID samples testing. In a bid to support Corona warriors, Defense Food Research Laboratory, DFRL, MISR has developed this quick response asset to deal with a situation arising due to contagious diseases including the COVID-19 pandemic. The laboratory stationed on a mobile platform has been named PARAKH. It provides unidirectional airflow and gradient negative room pressure with Class 3 Biosafety Cabinet (BSC) for entry and safe processing of clinical samples. Medical professionals can easily and safely handle and preserve samples from disease outbreaks or during surveillance. The lab has been handed over to the Viral Research and Diagnostic Laboratory (VRDL) of MISR Medical College and Research Institute to enhance their testing capability conducting COVID-19 tests at its high-tech Viral Research and Diagnostic Laboratory (VRDL). Fifth, drone-based surveillance system. An unmanned aerial vehicle, drone, is configured for surveillance of COVID-19 hotspot and containment zones to ensure strict compliance of lockdown guidelines in densely populated areas, where streets are too narrow for motorized patrolling and police personnel are susceptible to infection in case of manual patrolling. The system has been developed by TBRL, Chandigarh in collaboration with industry partner. The size of drone is 2.5 feet by 2.5 feet and weight is less than 3 kilograms. It can be remotely operated through a handheld tablet. It can fly up to 60-meter altitude and has a range of 3 kilometers. The system has been demonstrated to the Chandigarh police in a containment zone. 6th, Medidoot, medical trolley. Medidoot medical trolley is designed to supply critical items, food, cloth, and medicine to the patients in the isolated wards, thereby reducing the exposure of doctors and other health staff to the infected area patients. The design of M/2 Janu Technologies, a startup, was reviewed by ASL, DRDO, and product was improvised to suit the COVID-19 requirements. Trolley is remotely operated by a trained person to carry medical supplies, medicines, food and clothes to the designated patient in a remote location. Acoustic Throat Infection Analyzer, ATIA. NPOL has developed a throat infection analyzer, ATIA, using acoustic data processing techniques used in defense applications. The ATIA aims to detect upper respiratory tract infections by non-invasive means of acoustic scanning of words spoken by a person. SAMIC video conferencing solution in internet. This VC facility is provided for DRDO community to meet the requirement of uninterrupted working. This VC facility has been set up in DRDO premises and is named as SAMIC. It is based on Webex video conference and it uses modern XMPP communication server for high-performance audio-video conferencing. Detailed SOP has been issued by DRDO. DRDO officials and MOD departments units may obtain user login access credentials for SAMIC VC facility, as per their requirement. Crowd Temperature Monitoring System. The crowd temperature monitoring system has been developed using expertise in infrared imaging for missile applications. DRDO Lab in collaboration with industry partner has innovated and developed algorithms for thermography in outdoor conditions. Advanced face detection techniques have been used over thermal images. Estimated unit cost of the system would be about 2.5 lakhs for the basic configuration, camera, computer, with about 0.5 lakh for accessories, tripod, reference. AI-based intelligent COVID-19 detector technology for medical assistance, ATMAN. CAIR, DRDO has developed an AI-based intelligent, secure, web-based COVID detection application software ATMAN using chest X-rays, which can classify the images into normal, COVID-19 and pneumonia classes using limited number, few hundreds, of sample images. Virus affects the lungs early, even before the patient starts showing significant symptoms. Thus, compared to RT-PCR test which takes many hours, an X-ray based diagnostic tool can detect the infection in early stages with processing time in seconds.